What's the one thing that you'd like people to take away?
Yes, I think, we have mentioned it already, but it's that really early identification of risk, having the questions built in there, the right questions that are built to pull through. Like I said, what was the risk already known? Is there a new risk that you've identified? Have we captured it? Have we documented it? Have we taken the action to address it? And I think because our questions have been, like I said, built to the best practice around that event, looking at risk assessments that are already widely used across the sector, for the Falls event, looking, are we capturing all of the risk factors that could be contributing to that fall? And I would like to say, hand on heart, that we have put all of those questions into these toolkits, and it's just going to, like I say, be able to capture and evidence that those preventative measures have been put in place, but also the learning has happened, and we shouldn't just be learning from the events that are seemed negative. Somebody has had a fall, but things like compliments, things like pals. We should have, learning outcomes. We should be learning from the positive, as well as we're very good at focusing on what, the negative and what we need to do. And we're not so good at capturing the compliments. Obviously, we do have the compliments toolkit, but it's then about, how have we shared that? Have we shared it within the location, within the staff involved? Have we shouted about it, across the organisation, across social media, however organisations want to sort of raise that awareness of the positive. So definitely risk prevention and learning. That's the two key objectives of our toolkits.